Good evening. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us this evening. Well, for those of you who have type 1 diabetes, imagine a lightweight, very tiny wireless pump to help you manage your daily insulin intake without being attached to a bulky device. Well, joining me is Dr. Michael LeMay. He's an endocrinologist to talk more about the OmniPod and other technology out there for type 1 diabetes. Dr. LeMay, thank you so much for joining us.
No, thanks for having me.
Well, you know, this is really life-altering for patients because it's giving back their freedom. Explain that, if you will.
Well, insulin pumps provide insulin continuously to the patient. It allows them to get different rates at different times in their life, whether they're exercising or sleeping or eating, and so it provides them with greater flexibility. Most patients love the freedom of being on a pump, and so I very rarely have ever had a person go on a pump and then decide they don't like it. They really like the flexibility, the options that it provides for them. Okay.
And let's talk about, because this is mainly for folks with type 1 diabetes, is that right? Let's just talk about the difference between 1 and 2 for folks out there.
Yeah, and so type 1 diabetes is when your body stops making insulin. And so it's usually autoimmune disease in which the body has attacked the cells of the pancreas that make insulin. And so that person can't secrete insulin anymore. You need insulin. You can't live without it. And so as a result, people need to inject insulin subcutaneously several times a day or get insulin continuously through a pump. Type 2 diabetes is more of an insulin resistance in which the body makes insulin, but the body is not very good at utilizing it, and so it needs a little bit of help either through physical activity, better diet, pill types of medications, or other injectable medications, including insulin. If you're on insulin, it doesn't mean you're type 1. All type 1s have to be on insulin, but some type 2s are on insulin too. And so just because you're a type 2 on insulin doesn't mean you've transitioned to type 1. But type 1 absolute need to be on insulin.
Need to be on insulin. Okay, and so there's ways to do that. So let's first talk about the OmniPod. And we have the syringes, which is typical. Some people are still on that, but not as many.
Sure, that's the old school way of doing it. And so it was, sometimes people draw it up out of a vial. And so you've got fast-acting and slow-acting insulin, and you draw itself out, and you give it to yourself subcutaneously in the abdomen, the thigh, the deltoid. Insulin pens, many people out there know about insulin pens, and so you just dial up the dose, and so it comes in a pre-filled sort of syringe, and you can get that. But the insulin pumps come in a variety of things. With subcutaneous insulin, you do a dose of insulin, and then you don't get any more until your next shot. With OmniPod or other type of pump, you get a continuous infusion, maybe half a unit per hour, 1 unit per hour, and then as you're eating, you bolus it because you need that extra insulin because of the things that you're eating. If you're exercising, you decrease it a little bit. If you're sleeping, you might decrease it, because people need different rates of insulin at different times of the day.
Now, I just want to show to the audience, if you hold up the OmniPod, and now this is something a little more conventional. You can see the lead here. You can see how bulky and big this is versus that. That's all you need right there.
Yep, these are both usable pumps right now. With this, the attachment would go usually on the abdomen, and the insulin is inside the pump there, and it comes through the wires.
At all times, yeah.
And so it's almost like a pager where you attach it to your belt or put it somewhere. And the major disadvantage is all this wiring. It can get clogged with insulin. It can get attached to something that you happen to be walking by and cause all kinds of issues. This is the OmniPod. And so the OmniPod gives different places in the body that you can do it. It's hard to do a back of the arm with the Medtronic pump, but with this, sure enough, it can attach right here. There is a glucometer and controller that comes with it that in order to adjust it, you need to have it with you, but certainly you could be exercising with this on. You're not going to have any problems with the tubing. This contains 200 units of insulin at a time, and so based on your consumption of insulin, everyone's a little bit different. This might last you 72 hours, sometimes a little more, sometimes a little less.
You know, your mic just fell. Let's just sort of reattach that right there. We want to make sure folks can hear you.
Yep.
There you go. We'll clip that right there. So you can see really the difference here, and you can see just as we sort of got this tangled up a little bit
Sure.
that could happen. That's
Sure.
a real possibility that
Yep.
would prevent insulin, right?
Yep, absolutely. And that's a major problem that people have. Sometimes they'll be sleeping, you'll be twisting and turning in bed, and all kinds of havoc can happen. But with this, less likely to have any issues since there's no tubing involved with it at all.
And what's I think nice about this is that it's the continuous insulin, whereas if you're working out or you're swimming, you would have to detach this.
Yes.
So you're losing that insulin, whereas here you can do those sort of activities, right?
Yep.
And does this have to be on your person at all times?
If you're adjusting the OmniPod, you need to have it with you. But let's say that I was here at the hospital today and I had the OmniPod and I wasn't anticipating any changes in my rates. If I left it in my car or left it at home, that would be totally fine. But this device allows for finger stick testing also and all kinds of other things. So it suits multiple needs. And so most people carry it with them. But if they left it at home accidentally, it wouldn't be the end of the world.
Yep, so you don't need that to charge this or anything.
Nope, not at all.
Nothing like that. And then this has to be replaced, is it every 3 days?
Yes, roughly every 72 hours, depending on your consumption of insulin. If you're using more than 70 units of insulin per day, you usually need to replace it faster than 72 hours.
Okay, we have a question from Lori. She asks, how does the cost compare to pens?
That's a great question. Well, the interesting thing about this is on a pump, often people use less insulin. They have better control on less insulin. And so your overall consumption per day, per week, per month, per year of insulin will probably be lower. And so the absolute cost would probably be lower because of that. But vials, which would be what would be used to fill this, and pens are very similarly priced. And so the difference in price overall for the same amount of insulin would probably be similar, but you might have better control on less insulin with the pump.
I think we Mike just fell again there.
Got too exciting.
We want to, yeah, that's good. Okay.
Yep.
So it really pretty much is what you're saying comes down to preference in terms of what's more comfortable for the patient in terms of what they're used to or what they're accustomed to.
Sure. I'll be honest with you. In terms of a pump, the person needs to be motivated. They need to probably finger stick a little more often. They need to know things about carb ratios and how exercise affects their sugar and how other things in their life affect their sugar if they're going to be successful. And so it needs to be a motivated person to use a pump. It's not something that you can attach to your body and it works autonomously and takes care of everything by itself. The person still needs to be very involved with their diabetes, but it provides them with greater flexibility.
And you bring up motivation, which I think is so important because in terms of managing diabetes, whether you're type 1 or type 2, that if you have uncontrolled diabetes or you're mismanaging your diabetes, it can get out of control very quickly, and that can be dangerous.
Sure, and if you allow your sugar to get too high, long periods of time, it affects the nerves, the eyes, the heart, the limbs, and so I always tell my patients if they're out of control, they're running towards complications. Where if you have great control, great blood pressure, great cholesterol, getting dilated eye exams once a year, a whole bunch of other things are important about diabetes. But if you're doing all of that, your quality of life, your longevity, your happiness should be similar to a person who doesn't have diabetes, and that should always be the goal. No complications, great life.
Yeah, absolutely. Really simple there. Yep. If somebody does have, type 1 diabetes, what should they be? Should they be just monitoring their blood sugar? What should they be really monitoring to really get a grasp on it?
Well, certainly finger stick data or blood sugar data is really important. Something we haven't talked about today is something called the continuous glucose monitor, which can be used in conjunction with the pumps. It's something that sticks also to the body and provides the equivalent of finger stick data every 5 minutes. And so that's awesome because those people who do finger sticks, you do finger sticks maybe once a day or twice a day or 5 times a day or 10 times a day. Even if you did it 10 times a day, which is a lot, with the continuous glucose monitor, which again sticks to the body, lasts usually around 7 days or so, it's giving you finger stick data every 5 minutes. It gives you an alarm if your sugar gets too high or too low, so you could tail off the insulin a little bit or add a little insulin a little bit. You get to see the effects of exercise, the effects of what you're eating. the effects of your medication and the insulin. And so finger stick testing is important. Use of a continuous glucose monitor is really the gold standard along with pump in terms of type 1 diabetes. But sure, knowing what your sugar is and knowing how you're living your life is affecting your sugar is super important.
I want to talk about some of the trends, and one of the interesting trends that you seem to be seeing is that you think type 1 diabetes, you think adolescents, you think younger people, but that's actually not the case, that you're seeing many patients that are middle-aged and even elderly developing type 1 diabetes later in life?
Well, again, type 1 diabetes, absolute deficiency in making insulin. You can't make it, and so you need to inject it. Most people with type 1 do get it earlier in their life. Most people before the age of 20, I had a roommate in medical school who got it in his mid-30s. I have patients who have got it in their 50s, 60s, and 70s. And so often people think of type 1 diabetes as adolescent acquired diabetes, when in reality it can happen at any point in your life. And so it's something that you always need to be thinking about. But truly, the vast majority of people are diagnosed earlier in their life.
Do we know what causes it later in life, why we see it?
No, the cause of type 1 is probably something environmental or something genetic. It's something that happens that causes this autoimmune reaction in the body to destroy the beta cells of the pancreas, and as a result, it results in not being able to make any insulin. It can happen at any age, although that exposure, it must be something that happens commonly early in life.
Right.
And so people who get it, honestly, in their 50s, 60s, or 70s are lucky that they didn't get it earlier in their life.
Earlier, right. And you think you're in your 50s, 60s, and 70s, that, it can't be type 1 diabetes. But what are some of the symptoms that if you do experience, and you are that age, you could very well have type 1 diabetes? What should you be looking out for?
Well, either type 1 or type 2, often high blood sugar can cause you to urinate more often, and as a result of urinating more often, you get dehydrated, so you're drinking a lot of water, and so waking up in the middle of the night to urinate where normally you don't. But initially with type 1, it can cause all of those symptoms, plus sometimes abdominal discomfort, changes in your vision, blurred vision. These are things you all should be thinking about if they happen. Getting the workup to make sure that there's nothing going on with diabetes.
Lori has a follow-up question. Any advances in continuous glucose monitoring? We're going to talk about the sort of the future, what lies ahead.
Mm-hmm. I do not have diabetes, but whenever something new comes out, I always try it. I tried the latest Dexcom continuous glucose monitor not too long ago, and it is awesome. And so just like with anything, with cars, with computers, you never know what's around the corner, what new awesome thing is going to be there. But I was trying the Dexcom recently, and I'll be honest with you, I rarely eat breakfast, but I happened to be having breakfast that morning, and before I had a bagel with cream cheese, and my numbers were great, and then I had the bagel with cream cheese, and went whoop, up, and then it showed me, came back down, and it was awesome because you could see the effect of what you were eating, and when I was wearing it, what the effect of exercise was, and what the effect of everything I'm doing in my life has an effect on the sugar level.
That's pretty specific.
Sure,
yeah,
it's pretty awesome.
Let's see.
And so to go back to answering that question, continuous glucose monitors, they are only getting better and better and better, and smaller and smaller and smaller, and someday, in the very near future, they probably will be integrated with the pump, and that might allow pumps to be autonomous and to work almost like a outside of the body pancreas.
I'm sure that is being worked on as we speak.
Yep.
Okay, Sanyetta asks, she's taking metformin and experiencing horrible cramping on her left side of her stomach. Can this medication cause strong stomach pains? Also, she's taking glyburide. Sugar levels are up and down. Is there a specialist, or how does she ensure she's on the right meds?
Okay, so this
Thanks
person,
for that question. That's good.
Yeah, this person's definitely a type 2 diabetic because they're on metformin. Metformin's only for type 2s. What metformin does is it allows the liver to metabolize sugar a little bit differently. She's also on glyburide, which causes the pancreas to squeeze out a little bit of extra insulin, so I know she's type 2. The number one side effect of metformin is GI irritability, bloating, diarrhea, and so she's suggesting that she may be getting symptoms like that. And could it be the metformin? The answer is definitely yes. The way to find out for sure, stop the metformin for a few days under the advice of your doctor, obviously.
Right.
And so stop it, see if the symptoms go away. If the symptoms do go away, you restart up the metformin. Do the symptoms come back or not? And if they do, you just don't tolerate metformin. Metformin's a great medication in that it lowers sugar but doesn't make it too low. It's very inexpensive. It will not cause weight gain, and so it's a great medication, but some people can't tolerate it. And so to answer a question, it could be the metformin. Mm-hmm. Now the glyburide, it's also an awesome medication. It can make your sugar too low. It can cause swings in the blood sugar level, which is maybe what she's describing. She might need something a little bit different that helps smooth out what those sugars are.
Good advice. I think, Sonia, to definitely ask your doctor before you make any changes,
Sure.
just to make sure that that is following the right path there. I want to talk about wounds and wound care, and
Mm-hmm.
you see a lot of diabetics associated in wound care, which leads, unfortunately, sometimes to amputations.
Mm-hmm.
I want to talk about or stress the importance of proper wound care, and if that were to happen, and to really take that seriously.
Sure. And again, this is in type 1 and type 2 diabetes. When I was in medical school in the 90s, we were doing our surgery rotation, walking around the hospital, seeing all the patients. And when you think of amputations, you think of the Civil War. You think of a long time ago. Mm-hmm. But in reality, half of our service was amputations due to uncontrolled diabetes. Mm-hmm. It is one of the things that should be motivating people to control their diabetes so that they don't get this one of many complications. Right. And so sure enough, if you're walking around, if there's a break in the skin, bacteria love sugar. It's what bacteria eat. And so it provides a portal into the body. Once you get that infection, it gets hard to get rid of. And so that's what happens in people with either type 1 or type 2, is they'll get this deeply rooted infection. And unfortunately, they get to a point where you just can't get rid of it anymore. So they just have to remove whatever part of the body it is that's infected. And it's tragic when that happens. So you want to make sure when you're walking around the house, you're wearing socks. When you're walking outdoors, you're wearing shoes. If there is a break in the skin, no matter where it is in the skin, you're taking a look at it and making sure that it never gets infected. What happens if it does start to get red or irritated or evidence of a problem like pus or anything like that? You need to get on that right away. You need to show it to someone, get the appropriate antibiotics, and if needed, go to a wound care center to make sure that you get rid of that infection as fast as possible.
And you know, diabetes is manageable. If you take care of yourself, if you pay attention to your body, if you really are in control of it, it's manageable. It doesn't have to get to that point. But I just want to make sure that, you know, folks out there really take that seriously.
Yeah. Sadly, diabetes is a job that you never get a vacation from, you don't get paid for, and you can't quit, and you just really have to be on top of it all the time to make sure that 2 years from now, 5 years from now, 10 years from now, 50 years from now, your body is in as awesome shape as it can be. And taking care of your diabetes is critically important for that.
Yeah, and there are methods like the OmniPod that we touched upon briefly tonight to help you control and manage your diabetes. And this is just one of many devices out there for that. It's not just about this. There are others that are similar to that as well that can give you those benefits and allow you that freedom. What else? What's coming down the pipeline in terms of diabetes care in the future? What can we expect?
Well, there are definitely different types of pumps than the ones we've mentioned today. Not that are available right now, but not only do they secrete insulin, they also secrete glucagon. Glucagon is a hormone where insulin lowers the blood sugar, glucagon increases the blood sugar. Why would you want to do that? Well, if you had a pump that could supply both and you were hooked up to a continuous glucose monitor, well, that continuous glucose monitor could see is your sugar high, low, or where it should be, and then based on that value, make some adjustments either with glucagon or with insulin. So it's almost like in your house when you have a heating and air conditioning system. If you set the temperature at a certain point and it gets too hot, well, the air conditioning comes on. If it gets too cold, well, the heat comes on. Glucagon and insulin are the heat and the air conditioning in that sense, and keeping a steady value. There are other medications for both type 1 and type 2 diabetes that are making it easier to manage. Less side effects, less hypoglycemia, things like that. It's an interesting time. In the last 10 years, there have been several medications that have really improved the quality of life in many patients. And so we'll see what comes up the line. The other thing, stem cell research, I keep my fingers crossed that hopefully someday we could maybe implant stem cells in a person. which would potentially give them a functioning pancreas without not only giving them the insulin secreting ability, but having it be something that the body does not reject. And so that would be awesome.
That would be something else.
It's the holy grail of type 1 diabetes.
There, yeah.
Yep.
So hopefully that's on the horizon.
Yep.
Lori does have a follow-up. Does insurance companies cover the OmniPod and other devices like it?
Usually, yes. For type 1 diabetes, often a pump is easy because they realize the benefit of a pump. The decrease in complications, the better control, the overall lower cost in managing a type 1 patient. In type 2 diabetes, pumps are harder for insurance to cover, but sure enough, the pumps are considered the gold standard for type 1 diabetes. Continuous glucose monitors are also part of the gold standard for both type 1 and type 2. Insurance companies are a little less excited about the continuous glucose monitor. I think it's probably a 50-50 shot with the CGM, the continuous glucose monitor, whereas with the pump, the answer is almost always yes, as long as the patient has given has shown that they are motivated in managing their diabetes.
So great dialogue tonight, Dr. LeMay. Thank you so much.
Yeah,
we really
thank you.
appreciate that. And we've had some great questions from all of you out there. We do want to mention that Dr. LeMay is going to be hosting a free community education class. That's coming up on December 13th. It's going to be held in South Windsor at 6:30. Yep. He's going to have all these devices there to show you how they work, to give you sort of a show and tell and answer any of your questions. So if you missed out on tonight, you have that opportunity on December 13th to meet him and ask him anything you want. You do need to register for that class. Just call that number right there on your screen. We'd love to see you there. So thank you for joining us this evening. I'm Hartford Healthcare's Tina Verona. We'll see you back here next week.